Welcome to the Cricket and Oz Vitality Dispatch instrument-assisted soft tissue therapy video. The connective tissues in our body are also referred to as fascia. We have many different layers of fascia in our bodies. We have superficial fascia, which lies underneath the skin and is a continuous suit of tissue, just like the skin is. And we have intermediate layers of fascia, which are around the muscles, in between muscles. We have deeper layers of fascia that wrap around all of the small blood vessels. We have deep layers of fascia around the internal organs. All of our internal organs, heart, lungs, intestines, all have fascial or soft tissue components to them that encapsulate and hold them in place. The soft tissues allow for gliding and sliding between the tissues, so they allow for mobility as one of their functions. They also have a function of creating stability and holding things together. As we go through life and we apply loads and forces to our connective tissues and fascia, the connective tissues change. This is a process called remodeling. Our bodies are constantly going through this remodeling process where, as compressive loads are placed on the tissues and pulling forces or tensile forces are put on the connective tissues, they remodel and change. Our tissues accommodate to shortened positions and lengthened positions depending upon the postures that we utilize on a regular daily basis. Also, the connective tissues have a remodeling process that happens with trauma. Postural traumas, referred to as microtraumas, and then we have macrotraumas, which are the single traumatic events like getting cuts or having blunt trauma to the tissues. As this happens, the normal arrangement of our connective tissues, which allow a gliding and sliding between them, we wind up having cross-linking between the tissues that inhibit function and inhibit flexibility. Also, with these cross-links, they can impinge upon the small nerve endings causing pain. They can create impingements upon the small blood vessels or the capillaries, inhibiting blood flow to those tissues. Ultimately, this can cause pain and painful syndromes that, until the soft tissues are released and these scars are released, the pain will be a persistent problem. The absolute best therapy, most efficient therapy that I've come across in all of my years of clinical practice is the specific technique of Graston. These are the Graston tools, various different shapes and sizes to work on different body parts. We apply this therapy. We put a lotion on the skin to protect the skin from being irritated. We start with very light strokes to warm up the tissues. Then we work deeper, working at different angles to affect releasing in different tissues, different tissue directions, and different fiber directions within the areas that we're working on. The treatment lasts for about 5 to 10 minutes on any particular area, so it's very quick, very efficient. As we're working with the tools, the specific nature of the Graston technique is a specific stainless steel alloy that was developed to have a resonance or a vibrational quality to it. With this vibrational resonance through the tool, I can sense what's happening in the tissues through the tool into my hand, making it a diagnostic and therapeutic tool. As we are working through the tissues, I can feel where areas will be rough or smooth, identifying areas of scar tissue. Also, as the color in the skin changes, when we work over areas of scar, the skin color changes and becomes kind of a splotchy or mottled appearance of redness within the skin. And we can use that as another indicator of where the scar tissue is and focus the treatment on those areas of focused scar. The effects from this technique is very broad scope as far as improving function and mobility and reducing pain. And the technique can also cause some bruising. Bruising is not a negative response to the treatment. It's actually an indication that we have found scar tissue. We've broken up those adhesions and creating a bit of trauma in and of itself in order to stimulate the body's healing and repair mechanisms into those tissues. And then as the tissues are stretched and movement is encouraged after the treatment, we help with improving that gliding and sliding between the tissues so that there is a repair and regeneration within the tissues in a better functioning way.